For them of you who don't know, Elijah was born with a congenital abnormality condition called Asperger's syndrome, okay, and it affects bone growth, etc. He then underwent first some craniofacial surgery when he was a baby, and unfortunately suffered a traumatic bleed at that time. So ultimately we've got a condition that he was born with. We've then got a condition on top of that which is a severe brain injury, and we know that all the secondary complications that are attached to having a traumatic brain injury. We're going to get wrong with him, okay? So we need to start off somewhere and understanding him. Now, I don't think there's a better place than to show you an X-ray. Everything is under stress, okay? Because of one factor. And can you see that we're looking at Elijah? And remember, the knee bone's connected to the thigh bone's connected to the hip bone's connected to the backbone. If you think that, you're not going to go far wrong. When Elijah's fit and well, he's going to come to see me, and I'm going to inject Botox into that muscle. Okay, I'm going to explain to you what this is going to do. It's going to change your management, and that's why you need to know about it today. Because Botox relaxes muscles. If I relax the muscle, what's going to happen to that joint? It's going to distract back down, yeah? So that takes him out of pain because it's not bone and bone. But if it's a little bit floppy, we're going to have to be a bit more careful with his overall management, agree? Yeah? Super. How many neurons do they think is in the human brain? Have a guess. Have a guess. 40.
100,000.
Keep going.
Million.
100 million. Okay? Complex. Anything that needed protecting, you would put bone around it. Okay? Yeah? Yeah? Perfect. Remember that. That's important. The problem is that anybody worked in brain injuries before? Yeah? Assault victims, 76% of the population are right-handed, so they would generally punch them with a left frontal lobe. Any idea what left frontal lobe controls? Yeah, it controls the right side, but what part also does other things? What else does it control? So they might end up with a right hemiparesis. Speech. Sexual tendencies, behaviour. What is the important bit is your cerebellum, the cerebral cortex, the bit that controls the country, yeah? It's a bit like taking Wall Street out of America, I don't really know. But yeah, something that keeps out the nucleus of it all together. What does the brain need to live, to survive? Oxygen. Super. How do you think the oxygen gets to the brain? Sorry?
In the blood.
Yeah? Has anyone heard of carotid artery?
Yeah.
Right, passes down the side of that. But actually, the base of his brain was starved of oxygen and he had a significant bleed that affected his movement and his function. Okay. The grey stuff on the outside is a bit like when you go to a museum and you put your hands on your hair sticks up. Mine wouldn't, but you get the drift. Yeah? Yeah? And then it sends all this computer, so these are the 100 million neurons that send all this information, synapse it straight down the spinal cord, yeah? Because in my spine, we've already talked about position. There's 33 bones from my tailbone to my base of skull. And at each level, it subdivides, yeah? So around here it comes down to the fingers, around here it goes to there, around here it goes to my bottom, legs, so on and so forth, yeah? And that's how we work. So it comes through. So it sends all the information into the white matter that sends it down the spinal cord. Now, very, very important to understand this. And there are certain things we're going to have to take away today, and this is one. Okay, there's only 3 things. Your somatosensory feedback loop, okay? People get this wrong, okay? People far cleverer than myself. The cortex, the cerebellum, is made up of 2/3 sensory and 1/3 motor. Motor, we mean movement, okay? Which one's got the bigger pull then? The sensory, 2/3, yeah? Then it's 1/3. His sensory afferents are heightened, agree? Because he's had an injury, okay? We are all constantly getting external feedback to our system. We don't realise how complex the nervous system is, okay? It's constantly adjusting. Go back to the United Kingdom, we've already said he can't move himself. So if he's in pain, discomfort, what can't he do? Move. So you just wiggle, you just had a little wiggle there, just change your bottom, yeah? It's what we do constantly. Elijah can't do it. Yeah? So his somatosensory feedback loop is significantly at a deficit, yeah? So his sensory afferents are far, far more overactive than ours. The homunculus is a part of the brain that detects sensitivity. Okay? Which part of your body is most sensitive?
Your mouth.
Yeah, or motor control. Your mouth is the far more sensitive place. 64 stages of it. What do we do in Elijah's mouth? Suction. Is suction pleasant? No, it's not. Okay. We've already said that his sensory afferents are raised, and we've already said that everyone's motor control is the most sensitive place of their body. Agree? And then we're going to do something that's quite traumatic. So in theory, we want to try and prevent suctioning, don't we? Today we've got to take that out of the equation because he needs it. Yeah? So we've got to try and look at other ways of managing his overall condition. Agree?
Yeah.
Where else is sensitive?
Nose.
Nose. Super.
Feet.
Feet. Top, bottom?
Bottom.
Bottom, okay, good. Well, somebody told me it was the top of the foot.
No.
Yeah?
Hands.
Hands, which side?
Palm.
Palms, yeah? Inside, yeah? Inside your legs? Okay? Now, I'm sure that most of you have had a glass of wine in the room. It's fine. It makes you feel better, yeah? Or maybe not. Yeah? If you have 2, 3, 4, 5, 6, you start to lose the ability to function. So we need to reinforce good movements. So when Becky's saying, can we do stretches, movements, etc., it's not about increasing muscle length. Yeah? If I said to you, go back to picture A, we're going to do a stretch on his back every day, it's not going to make a blind bit of difference. It won't even maintain it. It will still deteriorate, yeah? It's about being aware that muscle has memory, joints have memory, tendons have memory, bones have memory, the spine has different levels. It's far more complex. We don't need to be physiologists, but we just need to be aware there's more of a reason to why we're doing what we say. Elijah doesn't have that ability to tighten his muscles on and off, okay? So we need to do it for him and give him good positions. So thinking about anatomical alignment is that when he's seating, yeah, we need to make sure that everything is in situ because his base of support has been increased, yeah? Agree? It's all about this, okay? And we've seen that, why has he got dislocated hips? Any idea?
Because he's not walking, standing.
Okay, so he hasn't had normal development, one factor. What else?
His muscles haven't kept his hips in.
Muscles, why not?
He doesn't use them.
Okay, doesn't use them, okay. Somebody who's got spasticity is unable to control the release of energy into the muscle. Okay, muscle control, okay? He's dependent on us. He needs us for everything, okay? So that's what you've got to do. You've got to give him the feedback, you've got to make sure that you look after him well. We've got to influence his muscle tone, okay? 24 hours a day, we're influencing it. When he's asleep, we want his tone to be down. When we're sitting him on your knee, we want his tone to be higher. Yeah? So we have to start thinking about his whole environment. Anything you do with him, anything, okay, what anybody else says, you influence his tone. If you want his tone to be higher, you reduce his base of support. If you want his base of support, if you want his tone to be lower, you increase his base of support. So we need to improve his sensory feedback. We need to enhance his biomechanical advantage, and we need to influence all of these. Now, if we can give him increased proprioceptive position, If we can give him increased proprioception awareness, we're going to improve his joint position. So we've got to influence everything. This is the key aspect. Keep everything central. Yeah. Yeah. If he's got an ingrowing toenail or increased breathing rate, which one's more important?
Breathing.
Simple. Yeah. So keep looking here. Basically, what would happen is if you ever hear that he's got a GMFCS of level 5, basically the most highest level of disability. Okay. Apart from looking like a pumpkin, that looks pretty normal. This is someone who's suffered a brain injury at 6 months of life. So can you see how Birmingham and Bristol have been taken out? Yeah? Okay, spasticity. Remember we talked before about spasticity? It happens when it resists, okay? So that's what happens if your spinal cord comes on, muscle spindle contracts, you can't switch it off. Okay, different types. He's starting to get contractures. If he gets contractures we can't do anything about. A contraction means it's fixed. If something's fixed, then we can only change it with surgery. Children like Elijah don't respond very well. Always surgery. Picture A is my arm. Okay, it's nice. You see, the thing that's shining at the bottom is a bone. You've then got a muscle on top. You see the fibrosis, the line, and then another muscle on top. The bit above it is fat, and then you've got the skin right at the top. Everyone read that, yeah? That's what an ultrasound picture. Exactly what you'd see with a baby. E is the same picture, but in Elijah.